Congressman Mike Simpson sometimes talks about balancing the budget. And in fact, he claims to favor a balanced budget amendment or legislation that would require Congress to balance the budget. It's pretty easy to say you favor that when you know that that's never going to come up for a vote. That is something that has been around for decades and has never passed and is not likely to pass anytime soon, although I would love for that to pass as well. But he gives lip service to that, but I'm skeptical as to whether he really endorses and supports that. When he talks about the national debt and balancing the budget, Congressman Simpson often likes to differentiate between what's called mandatory spending and discretionary spending. Discretionary only makes up, I think, maybe 28% of the federal budget. Less than a third of the budget is discretionary. More than 2/3 is so-called mandatory spending. Mandatory spending is for programs that are called entitlement programs, programs that provide money that people are entitled to by law. So even though he also says, yes, I know that someday we need to tackle these entitlement programs, in his 26 or 27 years in Congress, he has not yet tackled them, so I'm not holding my breath for that. But he often claims that because discretionary programs represent such a small part of the budget, it's really hard to balance the budget or to vote for a balanced budget because so much of it is these mandatory programs. So the big three for the mandatory programs are Medicare, Medicaid, and Social Security. These are programs for which money is taken out of your paycheck. I'm sure you've seen that, the FICA withdrawals from your paycheck, something that's been going on for many years that I'm very opposed to because it softens the blow of these taxes and makes us not think about how much it is that we're paying in tax for these programs. Even though we are paying so much out of our paychecks into these programs, they are not stable or fiscally solvent. There are all kinds of predictions that they're going to go out of business or run out of money within 10 years, 12 years, 15 years. Hard to say, but it's very clear that they are not working effectively. That being said, because I and all of the wage earners in Idaho have been paying into these things our whole lives, I would never vote for something that would say, you don't get any of that money back that you've been paying into it. We should all get all of that money back with interest. That's the whole idea of these programs, even though other programs take that money and spend them on other things, which is terrible, sort of like a pyramid scheme. So there's nothing remotely constitutional about Medicare, Medicaid, or Social Security. And in fact, Medicare and Medicaid are two of the things that drive healthcare costs in America much higher than they need to be. They make it uncompetitive or anti-competitive. They bring us much closer to socialized, single-payer healthcare. And so I'm very opposed to them on those grounds. But it's important that voters understand that I wouldn't just abandon these programs and leave everybody high and dry. So many of us are depending on those things in our retirement. There are lots of poor people who depend on Medicaid. And certainly I'm counting on Social Security income. I don't have tons of money saved up with my wife. So we will be living off of that to some extent, as will hundreds of thousands of other Idahoans. I'm sensitive to that, aware of that, and certainly would not kill those programs on that basis. Would I be interested in tweaking them to make them better? Absolutely. I'm open to suggestions and proposals in that respect. And if we're going to have those things long term, they should become constitutional. We should amend the Constitution so that we are consistently following the rule of law.